We're going to get started right at 10 in just a minute or so. Okay, well, by my clock, it says 10 o'clock, so let's get started. My name is Nancy Glennon. I'm with DECA, and I'll be moderating this session. Just a little bit of housekeeping. We're going to ask if you could please keep yourself on mute, and we'll open things up for the last 5 minutes for questions, or you can put your questions in the chat. And I think that's about it. So I'm going to turn it over to Ray, and she's going to introduce herself and the other speakers as well, and we'll get started.
Great, thank you so much, Nancy. It's good to be with you all today. My name is Ray Hutchison, and I serve as a public health analyst in HRSA's Office of Regional Operations. We've recently transitioned to the Office of Intergovernmental and External Affairs, also known as HRSA IEA, and it's good to be with you this morning. I'm excited to share with you a little bit about HRSA's efforts to address substance use, particularly those efforts around maternal health. I'm going to start us off this morning by talking a little bit about HRSA, who we are, what we do, and what we're about. And then I'll switch gears and talk a little bit more about the office that I work in, which is HRSA IEA. And then I'll turn it over to my colleagues in the Federal Office of Rural Health Policy to talk a little bit about their efforts, particularly their efforts with the Rural Communities Opioid Response Program. All right. Before we dive into the HRSA overview, over in your Pathable platform in the poll section, we do have 2 poll questions just to get a sense of who's joining us for this session. Asking you, are you a HRSA grantee? And then learning a little bit more about your role in your organization. So if you could let us know, are you a HRSA grantee? And then what is your role in your organization? We'd greatly appreciate it, just so we can get an idea of who's joining us this morning. All right, so HRSA is one of 11 operational divisions within the U.S. Department of Health and Human Services. I'm really proud to work for an agency that has a mission that's driven by improving health outcomes and tackling health disparities. At HRSA, we work to improve health outcomes and address health disparities through access to quality services, a skilled health workforce, and through innovative high-value programs. At HRSA, we're known as the Access Agency. We work to improve health outcomes and address health disparities by creating access to care through the operation of over 90 different programs. We are a grant-making organization, and we create access to care through grants and cooperative agreements that provide healthcare to people who are geographically isolated, as well as those who are medically vulnerable or economically vulnerable. We operate grants and cooperative agreements to over 3,000 awardees and to a wide variety of organizations. So we provide grants and cooperative agreements to community and faith-based organizations, colleges and universities, rural health clinics, hospitals, health centers, local, state, and tribal government, as well as a variety of public entities. HRSA has 10 regional offices across the country, and staff who work in these offices represent several different parts of HRSA. As I mentioned earlier, I work in HRSA's Office of Intergovernmental and External Affairs, or HRSA IEA. Our office was formerly known as the Office of Regional Operations, and we've recently transitioned to HRSA IEA to better align HRSA efforts with those of the HHS, Office of Intergovernmental and External Affairs. HRSA IEA is one of the components of HRSA that has a regional presence. In addition to HRSA IEA, other bureaus and offices within HRSA have a regional office presence. In the HRSA Region 7 Kansas City office, there is representation not only from HRSA IEA, but the Bureau of Health Workforce, the Maternal and Child Health Bureau, and the Office of Federal Assistance Management. Later on in our session, you'll be hearing from 2 of my colleagues, Monica Rousseau and Kim Nesbitt, and they are with HRSA's Federal Office of Rural Health Policy. So HRSA IEA serves as the principal HRSA lead on intergovernmental and external affairs, regional operations, and tribal partnerships. And this aligns with the HHS Office of Intergovernmental and External Affairs and leverages the staff expertise and infrastructure of these functions within HRSA. It also leverages both national and regional engagement to meet the needs of communities across the nation. And this slide illustrates and gives you a sense of HRSA's IEA's organizational structure. HRSA IEA works across all of HRSA's program areas to extend the reach of the bureaus and offices, as well as to provide an additional touch point for HRSA stakeholders. As I mentioned earlier, there are 10 regional offices spread across the nation. We've got a headquarters office in Rockville, Maryland, and then a sub office in Puerto Rico. I work in the Kansas City Regional IEA office, which is also known as Region 7, and our team serves Iowa, Kansas, Missouri, and Nebraska. One of the cool things about working for HRSA IEA is that we're uniquely positioned in the field to gather and assess ground level intelligence about healthcare issues and trends that are impacting HRSA programs and stakeholders across our 4 Region 7 states. We serve as ambassadors, providing outreach and education to increase the reach, impact, and awareness of HRSA programs and resources. I like to think of us as a jack of all trades. We do a variety of different outreach, education, and technical assistance activities across our regions. And as ambassadors for HRSA, we can assist by brokering relationships and connecting stakeholders to HRSA programs, resources, and funding opportunities. So we deliver on the HRSA mission and our mutual priorities by tapping into an expansive regional network. And as you can see on the slide, we work with a variety of partners, particularly across Region 7 in Kansas, Iowa, Nebraska, and Missouri. From working with HRSA's grantees and state leadership to tribes and tribal serving organizations, community and faith-based organizations, among others, including our colleagues in other federal departments and agencies. This slide lists a few reasons why you might want to consider contacting HRSA IEA for assistance and support. We are here to serve as a resource for you and your organization, and we truly love hearing from you and engaging with you and helping you with your efforts in your communities. Whether you have questions about HRSA programs and resources, or looking for HRSA funding opportunities, or because you would like to share information with us, or you would like us to speak at a workshop or a meeting, we want to hear from you and connect with you. So I want to switch focus and talk more specifically about my team's work to address substance use with community partners and stakeholders across Region 7. So that's Iowa, Kansas, Missouri, and Nebraska. This slide lists some examples of our outreach, education, and technical assistance efforts conducted to address substance use across Region 7. I want to specifically highlight the trauma-informed care webinar series for Kansas community health workers. So earlier this year, our office collaborated with the Kansas Community Health Worker Coalition to coordinate and host a trauma-informed care education series for community health workers in Kansas as well as Missouri. This series focused on increasing CHW's knowledge about trauma and providing accessible interventions as they work with clients in their communities. The series highlighted culturally competent trauma response strategies, as well as building CHW's capacity to facilitate health equity among the communities that they serve. The series also touched on trauma related to substance use and interventions for working with individuals who have been impacted by substance use, including youth, young adults, families, and women of reproductive age. Our team has hosted a variety of workshops and collaborated with a variety of community partners to present at workshops aimed at addressing substance use. Although not specifically focused on maternal health, many of these workshops did include information to assist organizations who are serving women and women of reproductive age. We've also supported a variety of efforts that are specifically focused on maternal health and substance use issues. Our office, in collaboration with colleagues in our Chicago and Dallas offices, hosted a maternal health webinar series earlier this summer that was focused on substance use disorder and pregnancy, intimate partner violence, and health equity. The substance use disorder and pregnancy webinar highlighted HRSA's rural communities opioid response program, the neonatal abstinence syndrome, which you'll be hearing later about in this session, as well as maternal and fetal effects of substance use during pregnancy, signs of substance use during pregnancy, treatments for substance use during pregnancy, as well as referrals for pregnant women with substance use issues. The intimate partner violence session highlighted intersections of IPV with other health priorities such as substance use and maternal health, and the main barriers that prevent a woman who has experienced IPV from obtaining health care, including care for substance use, mental health services, and reproductive health. Our team also participates on a variety of workshops, one being the HHS Region 7 Harm Reduction Work Group. I serve as a member on this group, and we are currently collaborating to coordinate a webinar series focused on methamphetamine use across Region 7. That series will be kicking off next year, January 2022. We're aiming for mid-January. It's a series with 4 sessions. They're pretty quick, nice little bite-sized 30-minute sessions, providing information to set up the landscape of methamphetamine use across Region 7. And so more details to come. And if folks are interested in signing up and participating in that webinar series, my contact information will be later in the presentation, and I would be happy to share that information with you. I also wanted to share about the Regional Opioid Consultation Initiative. This was an initiative in March 2019, where we collaborated with HRSA's Office of Women's Health, HRSA IEA, and the HRSA office, the HHS Office on Women's Health. This regional meeting was an opportunity to bring a variety of stakeholders together to talk about key components of care coordination models for women with opioid use disorder who receive health services and HRSA-supported settings of care. The meeting contributed to an overall effort by HRSA to create a toolkit focused on women with opioid use disorder. The Caring for Women with Opioid Use Disorder, a toolkit for organization leaders and providers, provides tools for patient-centered coordinated care. And the tools are organized into 3 main focus areas, those being shifting the culture around addiction and treatment, engaging women with opioid use disorder in care, and then creating and maintaining partnerships that support care coordination for women with opioid use disorder. Over on the Pathable platform, I put a PDF version of that toolkit. So if you're interested in checking that out, there are a lot of really great resources and information in that toolkit, and I encourage you to take a peek. So I wanted to share a few helpful HRSA websites and resources, particularly where to find our funding opportunities. So if you're interested in learning more about HRSA funding opportunities, particularly open opportunities, I would encourage you to check out the link on your screen under open grant opportunities at HRSA. Right now, we do have a funding opportunity that's open until January 13th of 2022, and that's the Rural Communities Opioid Response Program implementation. And that's a mouthful, so we affectionately refer to it as RCORP implementation. We are accepting applications for this program again through January 13th, 2022. The RCORP is a multi-year initiative by HRSA aimed at reducing the morbidity and mortality of substance use disorder, including opioid use disorder and high-risk rural communities. This funding opportunity, the RCORP implementation, is a 3-year program aimed to advance RCORP's overall goal by strengthening and expanding SUD and OUD prevention, treatment, and recovery services to enhance rural residents' ability to access treatment and move towards recovery. We are aiming to award approximately 50 awards, totaling approximately $50 million. I've also on the Pathable platform put a PDF version of the Notice of Funding Opportunity. If you download that PDF, it gives you all the details about this funding opportunity, including the components that you would need to address in your proposal, as well as the eligibility requirements and some other information to help you build a proposal for that. Later in the presentation, Monica and Kim will be talking more in depth about the RCORP initiative and the programs under that initiative, but I wanted you to have a chance to hear about that, particularly as it's an open funding opportunity. I also wanted you to be aware of the HRSA Health Services locator tools. Services at HRSA Health Centers are available to all patients, regardless of their ability to pay. HRSA Health Centers approach care from an integrated approach, providing both primary care and behavioral health services, including substance use care, among other services. To locate a HRSA-funded health center, you can visit the link on your screen. The Ryan White HIV/AIDS program provides a comprehensive system of HIV primary medical care, medications, and essential support services for low-income people with HIV. This program also provides behavioral health services for those living with HIV or AIDS, including services to address substance use. To find a Ryan White HIV/AIDS provider, including where to get tested and to find services, you can visit the link on your screen. The Substance Use Warm Line is another HRSA-supported tool, and it provides free and confidential clinician-to-clinician telephone consultation focusing on substance use evaluation and management for primary care clinicians. Consultation is available Monday through Friday between 9 a.m. and 8 p.m. Eastern from addiction medicine certified physicians, clinical pharmacists, and nurses with specialty expertise. Voicemail is available 24 hours a day. And some of the consultation topics include assessment and treatment of opioid, alcohol, and other substance use disorders, approaches to suspected misuse, abuse, or diversion of prescribed opioids, managing substance use in special populations, including women of reproductive age, women who are pregnant, HIV, and hepatitis, as well as productive ways of discussing known or suspected addiction with patients. The Rural Health Information Hub, or RHI Hub, is another fabulous resource with a wide variety of information, including toolkits that can help organizations plan by showing what has worked in rural communities. Toolkits showcase program approaches that you can adapt to fit your community and the communities that you serve. An example is the Prevention and Treatment of Substance Use Disorders Toolkit that your organization can use to develop, implement, evaluate, and sustain rural programs to prevent and treat substance use disorder. And to learn more, you can check out the link on your slide. A few other additional behavioral health resources that also address substance use are listed here on your screen. Many of these behavioral resources provide a wide variety of information to address substance use, including opioid use, neonatal abstinence syndrome, and stimulant use. For example, the Maternal Health Learning and Innovation Center is a national resource center for eliminating maternal health inequities and improving well-being for all families in the U.S. This HRSA-supported center offers ongoing learning opportunities as well as resource center providing information on a variety of topics, including pregnancy and substance use, a harm reduction toolkit. There's also a toolkit for implementing substance use screening. And then there's also a promoting access to care for women of reproductive age with mental health and substance use disorders in rural communities toolkit. The HRSA Mental and Behavioral Health, Mothers, Children, and Families website also provides links to resources such as the Alcohol and Substance Exposed Pregnancy Prevention Initiative that offers training and technical assistance to increase Healthy Start grantees' understanding of the impacts of fetal exposure to alcohol and other drugs, and strengthen their capacity to engage in effective prevention and early identification activities with pregnant women, mothers, and newborns. The initiative also aims to address social, environmental, and broader behavioral health factors as they contribute to substance use before, during, and after pregnancies. And many of the tools available on both of these sites are available to the general public and other organizations who have an interest in learning more. So lastly, this is my contact information. If you have questions or comments, please reach out. Love hearing from folks across our region, and I'm here to serve as a resource for you. And at this time, I'm going to turn it over to Monica Russo, and Monica's going to talk a little bit more about the Rural Community Opioids Response Program, in particular the Neonatal Abstinence Syndrome Program. Monica, the floor is all yours.
Thank you so much, Ray. If we could advance to the next slide. Thanks so much. Real quick, can I get a thumbs up if people can hear me okay? First and foremost, thanks so much, Nancy. I saw you first. That was great. Hi, everyone. First, I want to say thank you to the Kansas Opioids and Stimulants Conference for having HRSA representing all of our great work. It truly is a pleasure to share this information with all of you. I am Monica Russo. I'm a public health analyst within the Federal Office of Rural Health Policy, here to talk to you much more about that rural community opioid response program that Ray was just talking about, and specifically the Neonatal Abstinence Syndrome Grant Program. So if we can go to the next slide, we can start by going over some brief objectives that really help me provide some context for the presentation. So we seem to be advancing. Can we go back a few slides? There we go. Yes. Perfect. Thanks. Oh dear. Is it advancing on its own? Okay.
I apologize, Monica. Yes, it is advancing on its own. I think I have it figured out. My apologies.
No problem. No problem. Okay, so just some learning objectives to provide some guidelines for how this presentation will flow. We'll first go over some of the functions of the Federal Office of Rural Health Policy. You'll be able to describe those functions at the end of this presentation. You'll also be able to describe the Rural Communities Opioid Response Program and the Neonatal Abstinence Syndrome Grant. And you'll be able to find resources to connect with those RCOR grantees and those NAF-specific resources. So if we go to the next slide. What is FORP, the Federal Office of Rural Health Policy? Well, the Federal Office of Rural Health Policy has two main charges. The first is to advise the Secretary of Health and Human Services on all things rural. So ultimately, rural communities have a bit of a harder time keeping up to date with the different healthcare changes going on in our country. And it is our job to make sure the Secretary knows what barriers rural communities have, what opportunities are in rural communities, and how we can really make sure rural is incorporated into all discussions of policy change, especially as it pertains to healthcare service delivery, payment, reimbursements. The other part of our charge, being the Federal Office of Rural Health Policy, is to create and administer meaningful grant opportunities in rural communities to improve access to care. We do both of these things with our four wonderful organizational divisions that you can see on the right side of your screen. There's the Community-Based Division, the Hospital State Division, the Policy Research Division, and the Rural Strategic Initiatives Division. I am housed in the Rural Strategic Initiatives Division, so I will dive a little deeper into that division, but I do want to draw your attention to the fact that the title is hyperlinked. So if you are interested in learning more about our other divisions, you certainly can do so by following that link. I, again, am in the RSI division, Rural Strategic Initiatives. We are the newest division in the Federal Office of Rural Health Policy. Our job is to respond to administration priorities and priority health issues in the country. So as you can imagine, the pandemic has been a huge focus of our time. So has the overdose crisis. These are the two big pressing issues of the administration of the country at this time. This is our charge, is to respond to those two priority health topics within the Federal Office of Rural Health Policy and with that rural lens. So if we go to the next slide, what is RCOR? Well, like Ray was mentioning, RCOR is the Rural Communities Opioid Response Program. This is our response, the FORP's response to the overdose crisis. And how we respond is with a very large program that is part of the HRSA-wide initiative to combat the opioid epidemic. The impact to date is over $400 million across 1,500 counties. So it is a very large program. I was told I have 15 minutes, so I unfortunately won't be able to go into depth on all of the different programs within the RCOR initiative. But again, that hyperlink is there in the title for you to peruse. If we go to the next slide, I'd like to start with just a few highlights about the cooperative agreements involved in RCOR, because these are things that you might be able to leverage whether or not you do become an award recipient of this program. We have 3 cooperative agreements. We have the Technical Assistant Cooperative Agreement, Evaluation Cooperative Agreement, and Centers of Excellence Cooperative Agreement. The Technical Assistance Award was made to JBS International. They house our RCOR TA portal. This is ultimately designed to provide extensive TA and resources to our funded award recipients, but it is public facing. So this is obtainable for all people all the time. So I will absolutely make sure to go into farther detail later in the presentation on that. But the other item I wanted to draw your attention to were the centers of excellence. These are 3 centers that HRSA funds to provide better understanding and TA on how to tailor evidence-based practices to serve rural better. Ultimately, a lot of evidence-based practices are designed with an urban setting, in an urban setting, and sometimes those evidence-based practices don't always translate to rural very well. So we have funded 3 centers of excellence to make sure to provide rural communities the best information, the most up-to-date ways on how to tailor interventions, and which interventions are the most applicable for those rural communities. So those are just a few highlights about our cooperative agreements. We go into the next slide. We can go into a little bit more about those grant programs. You can see highlighted the Neonatal Abstinence Syndrome program. That is what I will be talking about for the majority of the presentation. Right below that is our Psychostimulant support program. My colleague Kim will be taking you through that. Before we dive into those 2 programs, which is of course the whole purpose of the presentation is to make sure you know about these 2 very relevant programs, I did want to draw your attention to the implementation opportunity. You can see there, Rural Communities Opioid Response Program implementation. This is the one that is open for applications right now until January. So these are $1 million grants that span 3 years for a period of performance. So please keep that in mind. This is a lot of money that communities can do a lot of great work with. They are doing great work with it right now. You can see how many people we have funded. So just keep that in mind as we go through, because there are many similarities between all of the programs. So it'll give you a good context of what that implementation grant opportunity is like as you hear me and Kim talk about the other 2 programs. Next slide, please. So why did we decide to focus on neonatal abstinence syndrome? We created a whole program. I'm so sorry. I'm in the office at HRSA and no one is here. So I'm sorry if the lights keep going out. We created a special program for neonatal abstinence syndrome because there was a great need. So my biggest advice to all of you is if you have a federal project officer, if you are a award recipient, make sure you tell them all of the things going on in your community, because this program was 100% created from the feedback of our grantees telling us there needs to be more work done in this space. We have an implementation grant, we have planning grants, we have all these grants, but we were absolutely told we need something specific to better serve our pregnant persons, our people who have recently delivered, and birthing people. The leading cause of pregnancy-associated deaths, as defined by the Center of Disease Control and Prevention, are homicide, suicide, and drug overdose. And you can see front and center that diseases of despair are front and center of pregnancy-associated deaths. Fatal and non-fatal overdose deaths increase with risk occurring between 7 and 12 months of postpartum. Some contributing factors include having a newborn with a diagnosis of neonatal abstinence syndrome and the impact of insurance loss at the conclusion of pregnancy. So these are some very powerful data points that we were keeping in mind at HRSA that we wanted to respond to. If you go to the next slide, you can see another point, another data point that really drove us to create this funding opportunity. The rate of substance use disorder related deliveries was higher for patients from rural than from urban areas. This is from an HCUP report from 2019. It is using 2016 data, but you can see how stark that difference is between rural and urban. That's a lot of SUD related deliveries in rural. And so of course we wanted to be able to respond to this and make sure that both the parents, the families, the children are all receiving the services they need so that everyone can live long, healthy lives in recovery and children can live stable lives with their parents. Next slide, please. So we created the RCORE NAS funding opportunity. This is just a very brief overview. It includes an award of up to $500,000 over the course of 3 years. We were able to make 30 awards in fiscal year 20. So we just finished our year 1, we're entering year 2. The ultimate goal of this funding opportunity was to reduce the incidence and impact of neonatal abstinence syndrome in rural communities by improving systems of care, family supports, and social determinants of health. A few things I want to draw your attention to. We included the words incidence and impact. We know that if we are doing our best evidence-based work, we will be linking parents up to buprenorphine services and methadone services, which might mean they still deliver children with neonatal abstinence syndrome. So of course we want to reduce incidence, but maybe more importantly, we want to reduce the impact of neonatal abstinence syndrome. We want to make sure that those parents are healthy. We want to make sure that the children and family are stable, that everyone is living as well and healthfully as possible. I also want to draw your attention to the fact that it is social determinants of health included, that systems of care are included, and family support. So a lot of things going on here. We didn't write a narrow funding opportunity. It is broad. It ultimately gives the opportunity for grantees to focus on actual service delivery or getting at some of the root causes for substance use disorder to begin with. Next slide, please. So some core components of the program, we wanted to keep the target population broad since we know substance use disorder does not just affect the one person with it, and it is a disease of isolation. So we know how important it is to include family, children, caregivers, and just the unit that supports the people who are struggling with SUD. So the target population includes individuals who are pregnant or likely to become pregnant, who are at risk for SUD or OUD, opioid use disorder, and their children, families, and caregivers. Click the next button, please. Thank you. All award recipients must work on 2 strategies in prevention, 2 strategies in treatment, and 2 strategies in recovery. So they work on 6 total strategies every given year for their 3-year period of performance. Next bullet. And they were allowed to choose a focus area. So we had a few different focus areas that were allowed to be selected: criminal justice, family support services, integrated care and care coordination, provider workforce, recovery capital, transportation, and telehealth. Next slide, please. This is the first funding opportunity our office has had where we were able to blend a planning strategy, a planning component with an implementation component. So we allowed for 6 months a very expedited planning option into this program, 6 months to dedicate to that strategic planning effort in which grantees spent most of their time creating logic models, a refined strategic plan, and really assessing the types of TA that they might need moving forward. Another component of this program is it has a very specific sustainability component. All award recipients must have a sustainability strategy that includes activities to improve collaboration with Medicaid offices. This was ultimately designed and added to help keep rural part of the conversations of what's going on with Medicaid, state plan amendments, 1115 waivers that are largely, as you've probably been hearing in the news, encouraging or the trend to encourage the 12-year Medicaid option for people who are postpartum. So we really want to make sure rural is part of that conversation and kept up to date on all of those opportunities. Other core components include meetings and technical assistance, and a very exciting part, which is our minor renovations flexibility, where award recipients may spend up to 20% of their total award on minor renovations. That is a big opportunity to refurbish buildings that are otherwise not usable or might not be used or might not be equipped to function in the way that would be beneficial for this target population. Next slide, please. So where are our NAS grantees and who are they? We have 30 NAS grantees in 21 different states. You can see that here on our map where they are represented. We have 7 different types of organizations represented in this cohort, and you can see all of the NAS grantees by clicking that hyperlink, which, as Ray mentioned, is in the website in a PDF format. Next slide, please. As I mentioned before, we had focus areas as part of this award opportunity. This is the breakdown of those focus areas. Grantees were technically allowed to select 2. focus areas. So we had 4 grantees who did do that. The majority chose integrated care, followed by family support. I think that's pretty common for a HRSA grant. I think most people who apply to HRSA grants want to focus on integrated care and service delivery. We had 0 awarded grantees who were focused on transportation. So we'll see what happens if this funding opportunity is available in future years. We know transportation is a huge issue, but not many people applied for that transportation option. Next slide, please. As I mentioned before, grantees had to choose 2 prevention strategies, 2 treatment strategies, and 2 recovery strategies in their application. And these are the strategies that they must work on for the 3 years, each year for 3 years. So here is a breakdown of those strategies. The strategy number 4 is the most commonly picked. So you can see kind of what our grantees are up to in those prevention in their prevention work. Much work is being done on coordinating the delivery of evidence-based prevention services and education programs to groups within the target population. So very innovative work being done there, making sure to identify people who are most at risk and providing tailored and the most relevant evidence-based prevention strategies to victims of and survivors of violence, of human trafficking, etc. Next slide, please. This is a breakdown of the treatment strategies that were selected. No one selected strategy number 8, so it's not on this slide. It was very reimbursement heavy, but you can glean a little bit more about what kind of strategies are being done in this grant. I will advance the slide to recovery strategies now, so that you can see the strategies in recovery. I do just want to remind everyone these slides are in the portal, and I really wanted to provide you this context so that you can think a little bit more about if you want to do this kind of work, what kind of strategies the cohort is doing might be very helpful in the work that you are doing. Next slide, please. So program overview, cohort characteristics. I know this group is specific to Region 7, so I wanted to make sure to highlight Region 7 grantee and just kind of give you an idea of who else is in your area. So I wanted to put the grantees who are in Region 5 and Region 6 on there as well. And now I want to highlight some of those grantees. If you go to the next slide, I wanted to talk a little bit about Citizens Memorial Hospital District of Polk County. They are in Missouri, servicing Polk County, and they have the focus area of integrated care and care coordination. They are very unique in the sense that they are leveraging those minor renovation flexibilities I told you about, and they are leveraging them to provide co-located care. Prior to receiving this grant, they were offering behavioral health services in a location that was deemed to be very obvious. So many patients did not want to go to the location because they didn't want to be identified as in need of behavioral health services by their friends and by their community. So the applicant organization and the consortium that are all part of this grant were able to move those services to part of a medical park. So nobody knows if you're going in there for a dental visit or an eye doctor visit or counseling or for buprenorphine. It really reduced that stigma and was able to provide better care in a co-located sense and make sure to address the whole person, not necessarily only focusing on one issue and referring to another part of a rural and difficult area to travel. Next slide, please. Texas A&M University is a good bit different. Instead of focusing on care coordination and integration, they're focusing on increasing recovery capital. You can also see they have many more counties in their service area than the previous grantee, which just shows you how diverse our cohort is. We have some grantees who are focusing on one county, and we have some grantees who are focusing on several. They're very unique in the sense that they're our only grantee who is focusing on building a recovery-oriented system of care, which is a lot of work, especially when working with several different counties. Next slide, please. And lastly, I wanted to highlight Illuminate Colorado. They are very unique in 2 ways. One, they are housed in Denver, which is not rural, of course. They are serving as the fiscal agent for Southern Colorado. So they are doing all of the technical reports. They are doing all of the administrative items, but the true beneficiary is that Southern Colorado service area that you see there highlighted in blue. So very unique in the sense that that partnering with an outside of rural partner to make sure to serve rural communities. This is a model that might be of interest to many of you. We receive so many applications from rural communities, but it's very obvious rural communities do not have as much capacity to create those applications in a way that they will get funded. Oftentimes partnering with a partner who is outside of rural could be a great option to make sure that you have the capacity to apply and report on data, etc. They're also incredibly unique because they are repurposing buses to provide childcare while parents are attending their mutual aid support groups or their recovery support services, their treatment services. And then that childcare actually includes evidence-based prevention curriculum. So very unique, very cool way to leverage the grant dollars. Next slide, please. So those were just 3 grantees of the 30. So if you want to learn more about them, if you want to learn a little bit more about the grantees and the programs, I'm going to show you how to do that. First, to learn more about the different core cohorts, I encourage you to visit this website at the bottom, which is hyperlinked, so that you can learn more about our implementation opportunities, our MAT expansion cohorts, etc. You can see the full range of where our grantees are and how much money is allocated in the different states. It's a really great way to see the program from a bird's eye view. Next slide, please. So to learn more about NAS grantees specifically, a really great option is to go to our data warehouse, data.hrsa.gov. This is a great way where you would not only be able to find the list of award recipients, but you'll be able to see their abstracts, their contact information if you wanted to reach out to them. So if you go to the next slide, you can see exactly how to get a hold of everyone. I'm so sorry, this is advancing. You can download an abstract, you can see what their service area is. So it really gives a good opportunity to see a little bit more detail of what everyone is doing. And if you want to contact them for more information or to partner. Next slide, please. And then this is where our forward focused funding TA provider, our core funded TA provider has all of the resources that are really designed for our award recipients. But again, as I mentioned before, they are available to the public. So all you need to do is go into the search and type in whatever you want that is related to opioid use disorder, substance use disorder, neonatal abstinence syndrome, and it will come up with all of the amazing toolkits, all of the amazing research, PowerPoints that have been provided by our TA provider to date. As you can see, just searching for NAS provides 171 results. So hopefully you find that as useful as our grantees have, and as we have, we find it very rich and important information that is shared. So those are just several resources available to all of you. If we go to the next slide, I have my contact information in case you have any other questions for me. And now I will pass it to Kim to take us through that psychostimulant opportunity. So Kim.
Great. Well, thank you very much, Monica and Ray. You received some informative information on a lot of our programs here at HRSA, and particularly the Federal Office of Rural Policy. And so today I'm going to be talking to you a little bit about our newest program, the Psychostimulant Support Program. So thank you for having me. It's a pleasure to share with you this new program. Next slide, please. So I'm just going to talk to you a little bit today, give you a little bit overview about the program for psychostimulant support and how we are utilizing this new funding opportunity to address psychostimulant misuse and use disorder. The newest our one and only cohort, since this is a new program, FY21. They just began September 30th. And just discuss some of the importance of the collaborations and partnerships that are necessary and helpful in addressing this work. And I also will just highlight a few of the prevention, treatment, and recovery strategies that are being implemented as a part of this program. Next slide, please. So as my colleague Monica has already gone over the rural communities opioid response program, I won't belabor it, but as you can see, this funding, the purpose was to reduce the morbidity and mortality of SUD, including OUD, opioid use disorder, in high-risk rural communities. And it's been inception since FY18 through FY21, and approximately $100 million have been awarded annually over those that time period. And as my colleague also highlighted, we've actually reached out to over 1,500 counties since FY 2018. And you can pretty much go to those links if you have more interest and want to peruse and get a little more in depth on how these programs operate. Next slide, please. Okay, so the Psychostimulant Support Program. You know, the goal is to advance and strengthen prevention, treatment, and recovery services for rural individuals around psychostimulant misuse and use disorder, and enable these people to actually access treatment and move towards recovery. The target population for this psychostimulant grant was for at-risk individuals or people that already been diagnosed, are in treatment or recovery for stimulant use disorder, their families, caregivers, the community at large in rural designated areas. So 15 awards were made for up to $500,000 per award. And that's over a 3-year period of performance. As I said, it started September 1. And it will end August 31st of 2024. So with that, keeping that in mind, this grant program has only been active for about 2 months. So I'm just gonna give you an overview of what this program looks like and what some of our grantees are proposing to do. And for the purpose of this funding opportunity, psychostimulants include methamphetamines and other illegal drugs, such as cocaine, ecstasy, as well as prescription stimulants for conditions such as ADHD and depression. So those are some of the targets in terms of substances that are also being addressed in this funding opportunity. Next slide, please. So a little background on this program. So, you know, as Monica indicated with the NAS, you know, based on hearing from our grantees, we were able to begin to look in a different direction and expand the funding. So, you know, the focus of the RCOR initiative to date has largely been around opioid use disorder. But there's a lot of evidence to support that there's an overlap between opioids and as well as psychostimulants. And then we're also seeing a lot of stimulants are laced with fentanyl. So again, so this brings importance to highlight psychostimulants and as well. And so, you know, with the RCOR funding, as you saw earlier, some of the programs that we've taken on in the past included the planning initiative, the implementation grants, the medication assistance and treatment grants, as well as you just heard from Monica present on the neonatal abstinence syndrome grant. So the psychostimulant grant is looking at moving towards addressing the current trends as a result of the data we see around an increase in psychostimulant use. We even seen that in the slides that Monica presented as well, how in rural communities, psychostimulant use is higher. And so the CDC reported that the drug overdose deaths involving psychostimulants increased by over a third in rural communities between 2016 and 2017. Next slide, please. So a little bit about our new cohort of grantees. As I said, we awarded 15 grantees. And what you'll see here is 13 states are being represented because we had 2 states, North Carolina and Ohio, were awarded 2 grants in their state. But hopefully going forward, we'll see how this new funding opportunity goes, and maybe you can partner in the future to address it as well. Next slide, please. I know we're short on time, so I'm gonna try to move as quickly as I can. So as I said at the beginning, how partnerships and collaborations are really at the core of this work. So we can't do it in silos. No one can do this work alone. So we encourage our grantees to develop a consortium. And so I will say this, just for time's sake, those are the guidelines that we ask for our consortium, our grantees to develop at least 4 partner agencies to make up this consortium, so that it's a group addressing the work, and there's ownership in the actual communities. But we also ask that they select a diverse group, whether to expand upon the work, and maybe it's faith-based groups, maybe it's law enforcement, maybe it's social service, but certainly considering a vast different variety of partners to sort of get this work done, as we know that it crosses the span, and it's not one group that can do it alone. Next slide, please. And so some of the core activities or core grant requirements include these 6. So these are the 6 areas that we asked grantees to address in their application. So they were to provide education on psychostimulant misuse and use disorder. So how would they tackle that? How would they provide education in the communities or to other professionals? We asked that they would identify and screen individuals at risk. So whether that's using the expert tool to identify patients and make referrals, so that people actually get the treatment that they need, or connect them, but not just identify and leave them hanging, but make those linkages to services. We also ask that they recruit, train, and mentor interdisciplinary teams, so that, again, as we talked about the consortium being various groups and with different expertise, the same in your interdisciplinary team, going outside the box and maybe training and recruiting those that you wouldn't normally look to, because again, to really address this these types of conditions, we have to do it together and cross lines, so that we could certainly give people all the tools to help them be successful. And so number 5 was talked about enhancing discharge coordination for people in treatment recovery. So as people are coming from a criminal justice system or coming out of treatment facilities, ensuring that they're, again, not just left with no resources or connections or no support systems. And then additionally, number 6 is to expand the peer workforce. So we know an important part of recovery is the peer support specialist. So helping grantees actually put tools in place to increase the number of peer support specialists so that people can receive help and identify with someone with a lived experience. Next slide, please. Okay, so these are some of the activities that are being implemented with this grant. So as I said, with the education, there's training, even at the in the school systems, because we know that with the stimulant, some are doing education around stimulant use in terms of misusing their prescription stimulants. So again, we have the life skills. There's anti-stigma education going on. And some of the other treatment and recovery, in order to give us time for questions, I'm going to try to be quickly and wrap this up. So treatment and recovery might include some of the things that are been effective for stimulant use disorder has been contingency management, community reinforcement, motivational interviewing, these things in combination. Specifically, since there's no approved FDA approved medication for stimulants, psychostimulants, these actual behavioral interventions are very important. Next slide. Great. So I was good in pushing through. So just leaving you with, since there in fact is no FDA approved medical treatment, it can be challenging to treat psychostimulant use disorder. So we're hoping that this grant and the various interventions being utilized will support and strengthen the practices to address the complexities of stimulant use disorder, such as the cognitive behavioral changes. So, thank you for this opportunity, and you have my contact information there if you want to know more about this grant and how things are going. I thank you for the opportunity, and I'm just gonna open the floor for questions at this time. Thank you so much.
Thank you, Kim, Monica, and Ray. And if anybody has a question, please unmute yourself, or you can put it in the chat. Okay, well, it looks like we don't have any questions at this time. So I guess it's time to wrap up. We have a few more minutes. Does anybody want to add anything else before we log off? Okay, well, again, thank you, Monica, Kim, and Ray. It's wonderful presentation. It's been great to have you. And this recording will be available in about an hour. So you can go ahead and check that out if you want to go back and review some of the slides. And thank you, everybody, for your participation.
Thank you. It's great to be with you. Appreciate the opportunity.
Thank you.
Thanks, everyone.
Okay.